Can a client bring in someone else on the first therapy session? Yes. Yeah, in most cases you can. Um, they just have to have paperwork signed appropriately. So for me, if it's a minor, the parents can come in, the guardians. Um, no one else unless we address it beforehand. So if grandma comes along, she's sitting in the lobby unless she signs paperwork. And typically, I don't even like that because to me, that's and I know people aren't active. Some people are trying to do this, not everyone. They're going around you as a professional. So the thing to keep in mind there is that the therapist has to maintain their role as the professional and they're in charge of the room. They're not controlling and domineering, but they need to be in charge of the healing space. And if someone else imposes on that, they're saying, "I'm in charge," and they're putting themselves in that space, and they will direct the room after that. So, if you're seeing a minor, parents, guardians, they're in the room. Any outside people, you need release of information and consents to come into the room. If you are an adult going to therapy and you want someone in the room, we need to sign paperwork for them to be in the room too. So, um, and that's HIPAA compliance there. As a therapist, don't let anyone in the room without a consent form. As a client, please don't encourage someone else to come in. I know, like, it makes sense to come in a lot of other doctors' offices. Like, if like I can go to most medical appointments with my wife and just go in with her if we want to, and vice versa. The reason it looks different with therapy is because the healthcare intervention is communicative mostly. So, you know, if for instance, if we were both, if I decided to go to an easy one is like a chiropractor or something like that. It's like, "Oh, I'm gonna get an adjustment," and maybe my wife comes, she just wants to see what it's like. She can't just be like, "Oh, my turn," and lay down on the table and get adjusted. That's not allowed because the actual medical intervention is what's happening in that moment. So she would have to get consents and any pre-stuff done prior. Therapy, the actual medical intervention, so to speak, is the dialogical process happening. So any communication happening in that space is technically utilizing the therapeutic space. Therefore, consents are needed because the whole room is a medical procedure in that sense. So, uh, but yeah, at the end of the day, yes, typically you can have guests in a first session, especially. Are psychologists and therapists allowed to date their clients? Yeah, that's a common question. I'm a marriage and family therapist. There are five main mental health fields: marriage and family therapy, counseling, social work, psychology, and psychiatry. All of them have codes of ethics. I've studied all of them. The answer to this question, I cannot tell you for four out of the five by memory. My field, marriage and family therapy, the answer is no, you cannot date a client. Actually, I can tell you for the direct answer is no for all of them. You cannot date active clients. Some have different rules on how long they can be not a client. So uh, don't quote me on this. I think counseling for counselors, they have to wait 2 years. So some of these have essentially statutes on them of regulation statutes of you can date and have normal relationships or relationships of any kind after a certain period of time. For marriage and therapy, marriage and family therapists, thank you, John, another therapist, counselor, 2 years. So there are some guidelines around it. MFTs, marriage and family therapists, who I am, nope, not allowed ever. Um, so in my opinion on this is super mixed. I 100% get it, and I can understand how that's annoying sometimes. But at the end of the day, the goal is to protect clients and overall client care. If you're having a mindset of I want to date this person in the back of your head, you're like leaning that way. You're like, oh, eventually I could. I don't know. It just maybe sets up potential to be creepy, and so I can understand complete restriction. The people I have the most empathy for with this are people who do therapy with focused communities. Um, I've seen this for maybe it's small towns. I've seen this with LGBTQ plus community. Sometimes people who do focused religious community work. And let's say you're not in a relationship or you're not married and you want to be, and everyone in your dating market is your target market for clients. That sucks, and that happens. So I get where that can be hard for some people, which is also another encouragement for people to maybe try to do therapy um, in different towns than they live in. That stuff gets complicated, but it's just kind of part of what you sign up for with this work. So, okay. Question 7. What is the process to becoming a psychotherapist? I'm very drawn to the role, but really did not enjoy studying statistics/experimental design when I took psychology at college. You don't have to know those things. Um, I love statistics. Um, Admittedly, I'd be guessing to fully understand what you mean by experimental design, but um, every degree is different, every program is different. My psychology undergrad was a technically a bachelor's of arts or bachelor of arts, whatever that's proper language is. So it was an arts degree technically, and my master's was technically a science degree, master of science. My arts degree, I took quantitative methods. We did a ton of statistics stuff in my arts degree, and in my science degree, we the only statistics that came up were like anecdotal random ones. We didn't study it at all. So I think it does depend. Most of my education in post or not post, yeah, postgraduate. Why am I thinking graduate studies? Geez, in my master's program, most of it was theoretical or practicum, live work. So with very little exception in there. Oh, I need correction. One class was 1 credit hour that was on research, um, and it was the easiest research course I've ever taken in my life. So it depends on the school. I went to Friends University in Kansas City. So yeah, what is the process? You need an undergrad in psychology or a related field. I think that can be subjective. Sometimes sociology counts. Um, Oftentimes, if you don't get a psych degree, though, you have to take required courses. So I went to a master's program where some of my classmates had to go back and take college courses their first year in their master's program. Like they had to go back because their undergrad wasn't in psych. That sounds stressful. So if you know you want to get into this field, just do a psych undergrad. If you're not sure what field, the joke when I was going to school at least was if you don't know what you want to do for a living, get a degree in psychology or business because you can use them everywhere. So half of my class like was like, I'm gonna be a doctor, I'm gonna be a researcher, and the other half was just like zoned out waiting to go to a party. So it was a really weird mix of people, and that's extreme, but you get the point. So um, undergrad in psychology, and then you need a master's of whatever the therapeutic subfield is that you want to be in. And that can be hard for people. I'm biased and think you should be an MFT. Uh, I'm sure that bias is consistent with everyone else and their respective degrees. I think there's a counselor listening right now, so he might be biased towards counseling. It's fine. Just look at I would recommend looking at the ethics codes, looking at whatever state you want to work in and what their um, potential regulations, statutes, and laws are for, like, I'm going to stick with the master's level psychotherapy, MFTs, counselors, social workers. There are psychologists that are master's level psychologists. I don't know that I would recommend that if you want to be a therapist, though. Do the other three probably. And it just depends. MFTs used to be set aside because we studied systemic work. So MFTs were really the driving force behind expanding therapy to not just one person in the room, but maybe the family or maybe other people, and to consider what else is going on. So someone coming in and not just saying, um, "You seem a bit crazy," but to think, "What's going on in your home? What's going on in your neighborhood? What's going on with the government and broader scale?" You look at systemic framing. Most of the programs do that now, but MFTs, that's why it's MFT, marriage and family therapy, because marriage and family therapies were not normal. So that was the distinct factor. Now it just sounds weird to people because now they just think that's all you do, but that's what we're stuck with. So most of them teach systemic frameworks now. So you're really just getting nitpicky with preferences at a certain point. I do think if you go the social work route, though, you're going to be more inundated with social justice type teaching. And so if that's probably better if you want to do what we might traditionally think is social work versus therapy, I actually wouldn't recommend getting a social work degree to be a therapist. I know social work therapists that are great. I think you're going to get more like therapy focus if you do counseling and MFT. So, but again, just look at the universities around you, try to talk to people that are in your area doing it, and that's the route to go. So, another question in the comments. I have a question that is slightly related. What is something you wish you knew earlier when becoming a therapist? There's probably a couple things. I think this one, I don't know, this is the first thing that comes to my mind, and it might not be my full answer. But I remember thinking just out of curiosity, I'm like, this is a field that you get really vulnerable and private information from people. And I found that curiosity of, what kind of depth of understanding of the world will I get because people are trusting me with information. Um, just the same way that maybe like law enforcement or military is going to get exposed to potentially a certain type of violence or stress that the average person won't see ever. There's like that kind of curiosity. I'm like, what is the depth of essentially this pain that I will see? Um, and as therapists, we're not allowed to just go tell all our client stories, but I did wonder that like years down the line, if someone were to say, "Hey, what's the hardest story you've ever heard?" I'm like, I wonder what an answer would be. And when I started doing this, and this happened in my internship, actually, many of the hardest stories I've ever heard were in my internship program. And I was like, what would be the hardest thing I could hear to share with someone? And you don't know what you don't know. And so I heard one story stands out, and I would feel so gross just repeating what happened. So, um, like that was my moment of like, oh, like the hardest thing to hear is actually something that I wouldn't ever say. So, uh, something I think is important to know there, and that I kind of wish maybe I would have known, is that you have to be all in with willing to accept the absolute destruction and trauma and violation that people can create on other people. And you will hear that firsthand. And we think about that. And I want to assure anyone who listens now or later, whatever you think the answer to that is, it is worse than that. So I just being clear with people, and that's kind of maybe what I would do back to people as my own antidote for myself is like, you have to know how to separate this from your regular life. And some people get really fantastic therapy stuff, and it's a lot more. I mean, people don't come in because they're having the best time of their life, but some stories are easier for sure. But you don't always know the story. And even someone who sounds like it's not going to be a big deal, whatever they're working on in terms of like intensity, there's a curveball that can just be brought up, and it's insane trauma or an incredible struggle. And that's hard. So I think having a better idea of the um, just the atrocity in storytelling you can hear. So a bit of a downer, I guess, but it's one of my encouragements to a lot of people that I actually don't recommend this field to most people, and I think most people should not do this work. Um, and people I think are maybe overly excited and encouraging about it. It can be really hard. I think you need to make sure you have a capacity, and for people who are caretakers, which a lot of this field brings in caring people who are a little bit more sensitive and emotional, that's maybe not a good mix if you're very sensitive and then you hear awful things. So I think knowing in advance that if you are sensitive, do you have a capacity to hold and not self-destruct with what you're holding, and be discouraged by the world when you hear that? But can you instead hear that and view yourself in a situation as a hopeful beacon forward? So yeah, uh, I like I said before, John, there's probably a couple other details in there that I can think of, but that story comes to mind a lot when people ask me to reflect on getting started. So, yeah, good question. And I'll answer it again if more thoughts come back later because I know there's more in there, but I don't want to spend too much time in silent reflection. So, um, ooh, I will say one more thing to it. I wish I would have known how many people would try to gaslight you into thinking that this work was very self-sacrificial and that you have to accept being poor your whole life. There's so many people that say that. And self-sacrificial in the sense of you need to be ready to just not make a living or not have boundaries and free time. Bad advice. You can absolutely do this work, respect your clients, and at the same time, um, do okay financially and take care of yourself and your family and have professional boundaries. That doesn't mean professional boundaries will be hard or easy necessarily. It's challenging. It doesn't mean we're always going to have pathways to the finances that we want. Sometimes we have to decide private practice, agency, this route, this route. Maybe I do this part time or not. But there's a really big narrative that um, we should make no money and that we should just be available all the time. And there's definitely room for people who have a lot of availability. Those people are amazing. That's actually a lot of social work. People have set themselves up for availability. And if you can do that, and that's you giving yourself permission to do that, not having it forced on you, fine. If you're in a position where you can offer uh, access that way, I know a lot of therapists who I don't know a lot. I know a handful that their spouse makes a lot of money and they can afford to charge less and their family's okay. Fantastic. So it's personal. I just don't think there should be a narrative that says you have to have these experiences. So um, yeah, just an encouragement for anyone getting into it. You'll probably hear those narratives. Maybe not a lot. My experience was a lot, but it's the majority of people, I think, in this field. The majority think that way. So okay. Question 10. Just chugging along. At this rate, we'll be done in 400 minutes. Good stuff. I'm actually having fun. I know I sound like I'm whining. Therapist is not trained to treat a certain client. Is it unethical for them to accept that client? Uh, yeah. Yes, it is. So um, it's plain and simple, but that line can be hard. Um, we actually talk about this a lot when we're training interns, because technically students are not trained. They're not specialized. So why do we let them see clients? One is they're supervised. So whether that's live supervision or like with most people, it's reviewed supervision where we watch case studies or watch videos of their cases or just review them verbally. So they have oversight. But yeah, there's a line. And honestly, most therapists practice outside of their scope. Um, and I think that's an issue of having a lack of clarity with even more subfields. I'm not a big fan of creating more segments, but if I say I'm a therapist, I've met therapists who've never seen a couple. They've never in their training seen a couple. And if you say, "Oh, I'm a therapist," it's possible that some people be like, "Can you do couples work for us?" And they'll say, "Yeah, I can do couples work." They should not be doing couples work. They have no idea what they're doing. They've never seen a family, they've never seen a couple, they've only seen individuals. They shouldn't see a kid either. Like it's just too broad. I wish we could specialize a little bit more. And you can get postgraduate specialties. Like I'm a play therapist. I'm not a registered play therapist because the application process is a nightmare, and I'm not interested right now. But that is my specialty, and I'm very well trained in working with kids. And when I hear other therapists say they work with kids, I can tell really quickly whether they're trained because I'm specially trained. And so, does that mean they shouldn't work with kids? I don't know, but I can tell you that a lot of the therapists that I hear who work with kids that I'm probably gonna do a better job because they're not trained. And there's a lot of examples of me and work that I could do, but I'm not trained. So I do think as a therapist, you should specialize. I think that is a wise decision. And a focused therapist offers better work than a generalized therapist. 9 times out of 10, I would say. It's a fake statistic, but often. Um, so yeah, it depends on what you need. I mean, if you're just like I'm stressed out a lot, you don't need to see an anxiety specialist. But if you get far enough in and you learn it's an anxiety disorder and you do need focused care, you maybe should. I see this a lot with ADHD. Some people just want help with ADHD, and technically, as a therapist, you're supposed to be able to treat that. It's in the DSM, Diagnostic and Statistical Manual. We're trained to technically diagnose it and treat it, but there's legit specialties and people do a really good job. So, as a therapist, ask questions on the phone, understand the client. As the client or prospective client, if it's important for you to have specialty, please be assertive on the phone and self advocate and ask questions. If it's important that your therapist knows something or can do something, ask them about it. Because some of them honestly will accidentally practice unethically. That's just I think that's how it goes. Um, and that's not an "oh, no" nightmare thing. There's just fine lines sometimes before acting within your scope or not. Again, let's say you're working on anxiety, and you are a specialist in anxiety maybe, and then, you find out through therapy, you're 6 months into therapy with someone, and then it comes out that they've had extremely traumatic points in their past, horribly traumatic, and they need intensive care. You couldn't have known that. So then we can try to figure out, is there anything I can do, or do we need to get you referred to a specialist? Or do what I mentioned earlier. We'll keep working on the anxiety and the specialist will work on the trauma. So, yeah.